Hi, I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on sports and exercise injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. Now, one of the questions I get about injuries that may or may not need surgery, whether or not you're an athlete or you're just active, you like to play sports for fun or for exercise, or you're just active and want to get back to work, one of the questions I get about the injuries is, would I need surgery if I'm active, or maybe I don't need surgery, or if I'm not as active, or are the surgical options different? And so in today's Ask Dr. Geier video, I'm going to discuss that distinction on how the treatment options may differ between somebody really active and maybe somebody that isn't for a very common injury of the shoulder. Okay, Sam asks, I recently, 7 days ago, tore the long head of my biceps tendon. I'm very active and a competitive 52-year-old male. I saw a PA for a reputable surgeon in the area. He evaluated me and stated that surgery would not be recommended. He said that only one of the surgeons in their practice performs the reattachment and that the tendon will reattach itself at the humerus in time at a lower area on the shoulder than where it tore. He stated that I should see 100% recovery without surgical intervention. I've had no pain but some cramping over the week. He also said that that should diminish over time. Should I be consulting with someone about potential surgery? Okay, this is a perfect injury to discuss that distinction between would a treatment differ if you're really active versus if you're not. Now first let's explain the injury. What he's talking about is the biceps. That's the big muscle in your arm. We all know that. That's the bicep curl that you do in the gym. But that muscle belly in your arm has tendons that attach down at the elbow and another tendon that attaches up at the shoulder. The long head of the biceps tendon is the tendon that attaches at the top of the shoulder. And it can be injured with overuse activities. There are ways to traumatically rupture it, but very often it sort of frays over time and then it finally gives. Reportedly, John Elway had that injury late in his career, and then it actually ruptured, and as the story goes, he actually had no surgery for it and won 2 Super Bowls. All of a sudden his shoulder pain was gone. Now having said that, again, I wouldn't use that necessarily as a basis for treatment, but it is a good way to point out what Sam's asking. You can do well without surgery for a tear or rupture of the long head of the biceps tendon. Now here's the distinction. Typically, if you're in your late 50s, 60s, 70s, a lot of times you won't even know that it ruptured. All of a sudden you may notice some pain for a few weeks and then finally it goes away, and that could be where that tendon was starting to fray and then it finally ruptures and the pain goes away because there's nothing pulling on the top of the shoulder now. So yes, older, less active people can do great without surgery for that. Usually you'll get most of your strength back. You may be weak. You're actually not really that weak with bicep curls, with elbow flexion, because the brachialis muscle actually helps with that. Where you might be a little weak is with what we call supination, activities where you turn your palm and your forearm up. Things like turning a screwdriver, turning a doorknob, things like that. So in really active people, athletes, people that do a lot of really physical activity like manual laborers, yes, we might consider doing surgery where we actually reattach it. It's called a biceps tenodesis. It's one that most of the time you do it through a small incision in your upper arm. Lift up the pectoral tendon and you reattach it with stitches and anchors into the bone, and then that gradually goes on to heal. You get back to full activity. But having said that, that's a fairly, there's a decent amount of recovery with that, getting that to heal and then getting the motion and strength back to the shoulder, but that can go very well. Having said that, I don't think that for maybe people that aren't as active, that non-operative treatment is necessarily a bad option either. I think it's important to discuss, just like you would with any injury, ACL tears, we talk about different treatments, for people in their 40s and 50s that may not be as active, maybe they don't need surgery. This is the same type of thing. So it's really important to discuss this with your doctor, with your orthopedic surgeon, and help to come up with the treatment that's potentially best for you. Now, have you suffered a biceps tendon injury at the shoulder, and what did you do about it? Did you have surgery to reattach it, the biceps tenodesis? Did you go without surgery and you just left with that little bit of a lump, that cosmetic deformity, and did you basically get back to normal? I would love to hear your thoughts, and I think it would help other people going through this, to read your experiences. So below this video, I'd really appreciate it if you'd share your experiences so we can hear how it went for you, how you decided on the treatment that you decided on. And if you know somebody with this particular injury at the shoulder, I would really appreciate it if you'd share this video with him or with her so that maybe it can help them kind of understand the options and maybe pick the treatment that's best for them. If you like more information on injuries and injury treatments and injury prevention and videos just like this, I record a number of these videos every week, so subscribe to my video channel. I would love to deliver these videos directly to you. And last, there's a number of resources that I create on ways to stay healthy and perform your best, and I'd love to deliver those directly to you completely for free. So go to my website, drdavidgeier.com. Below, right at the top of the page, just enter your name and your email address, and I'll give those directly to you. Thank you so much for watching. I really hope this was helpful. Remember, if you've had a biceps tendon injury, I'd love to hear your experiences, and I look forward to seeing you in another Ask Dr. Geier video next time.